This empty chair represents the addict who died today, not knowing recovery was possible.
Hi, and welcome to another episode of our show, The Empty Chair, Exposing Addiction. I'm Phil Lahey, and as you can see, beside me is not my daughter Colleen. She wasn't able to make it tonight. She will be back next month, and one of these days I'm going to let her be the co-host by herself. For those of you who've been watching our program over the last few months, what I ask you is to please talk to your friends, have them tune in, especially those who have children in the middle and upper high schools. They just might find something, that they can use. They might find something that's helpful. They may find some things, some knowledge that they get from this show where might kind of put up a red flag or give them an early warning. And that's something we're trying to do. We're trying to get to the parents of those kids to give them the knowledge that I never had so that they can maybe prevent some of these kids from going farther than they should. But that being said, what I would like to do now is introduce a very special guest. This is Jennifer Burns from the Moar group, and she came down here, and she's got a wealth of knowledge that she's learned firsthand and later on in the years too. So Jennifer, thank you for coming.
Thank you.
And I know you're nervous, but within 5 minutes, it'd be like it was sitting around my kitchen table.
Sounds like a plan.
All right, just give us a little brief background about yourself.
I grew up in an abusive home, a lot of trauma in my history. I started using probably about the age of 12 in school, and it progressed to the point where I was getting into trouble with the law, drinking and driving, making really poor choices. And in October of 2005, I entered a program through Northeast Behavioral Health, which was the Spiritus program, which isn't in existence any longer. And that's where my journey began. I kind of went in there thinking I could run the program better than the director, and some stuff had happened in a group, and I couldn't believe she was letting somebody go home on a weekend pass. And the director looked at me straight in the face and said, "Jails, institutions, and death, Jennifer. Take a look around. It doesn't get any better than this." And at that point, it kind of like opened my eyes. Like, she was right. I had some court charges pending in the Haverhill District Court, and I was there with my 6-year-old son at the time, and I dove in. I started going to meetings, getting connected with the community outside of the program, and I completed that program in July of 2006, and then from there I was in an apartment program that followed me for 18 months after my recovery with my son. I went back to school. I graduated from Middlesex Community College in 2008. This past May, I graduated from UMass Lowell, and I'll start my master's program in the fall. Not next month. I'll start my master's in community social psych at UMass Lowell.
Yeah, I'm so thrilled. I wanted to get all the educational background that you got now, because we do, those of us who are in the addiction family, there's an old wives' tale that addicts apparently they fail to learn after they become addicts. And I know you, and I know Colleen, and so many others, have proven this to be obviously wrong, because you obviously have advanced in your education, and I'm thrilled that I also know that the education you've gone to has gone through the disease that you have and helping others, which brings us to the group Moar. So why don't you tell us how you got involved with them and something about Moar in general?
Sure. In the spring of last year, Spiritus was closing, and I was employed there at Spiritus. I had gone back to work there. And the director of the Heart House handed me the information about Moar. the job position that was available. And I went and I interviewed, and I got hired last October with Moar. And Moar is a statewide organization. It stands for Massachusetts Organization for Addiction and Recovery. And we have many facets going on with Moar. The mission and the vision of Moar is to have a society where addiction is viewed as a mental health, community health issue and not a moral dilemma, where recovery is a win-win situation for the individual and for society. We advocate with our policy, we advocate and educate our policymakers. We hold policy forums. We had a policy forum in Northeast Mass and in Central Mass, and in Boston this past, I want to say, it was like the fall through the winter on underage drinking and opioid overdose in the Commonwealth. And, you know, the numbers are pretty high with that. There's an epidemic with the...
Well, yeah, you know, I'm glad you brought that up because, by the way I met Jen is through my daughter. I happen to be an ex-politician, and she kind of, they kind of used me in that reason. But we did develop a heck of a nice relationship where she's included me in an organization at the Recovery Center down the Psychological Center. And I remember at one of our meetings, we had the sad news that drug overdose became the 10th leading killer. It passed car accidents and so forth like that. So, and as you were saying, a lot of people just don't realize the numbers. And most of those numbers, you know, obviously are people 40 and under, because you don't usually see too many addicts dying of old age anyway. No,
and what we're seeing too in the field is a rise in the ages 18 to 25 entering into treatment, and a lot of it is the opiate addiction, which usually starts with a prescription that comes from a doctor.
Right.
And like, I mean, anybody that, I mean, you could line 10 people up and give them a narcotic, opiate, which is a painkiller, you know, Percocet, Vicodin and stuff, and after 3 days, all 10 people are going to be physically addicted to it. You know, it's the individual with the addictive brain that's going to take it the step further and seek out, you know, heroin or other forms that are on the street.
Well, and I'm glad you brought that up, the physical addiction part of it. You know, being a parent of an addict and not knowing much about it, I'm one of those ones who felt that it was okay for kids to experiment with this. I don't believe in that anymore, obviously, but when it comes to an opiate, there's no such thing as experimenting, is there?
Absolutely not.
Yeah.
Absolutely not.
So now I know your organization is starting to move into the Merrimack Valley, which you're having a big part of doing, because, again, we meet monthly down at the Psychological Center with different groups and organizations, people in recovery and so forth. And maybe you can tell some of the people exactly what are our goals as far as that?
As far as the group? It's to be able to have the community resources collaborate and work together to help individuals instead of being separate silos in a community. I mean, the funding is scarce, as we all know, and everybody's, you know, fighting for their piece of the pie, so to speak. And it becomes a disservice to the population they serve. I know there's been different, like we've had people from the food pantry come, we've had people from the Psychological Center come, we've had other agencies, other community agencies come and sit at the table. One of them was the Boston nurses, visiting nurses, and they're centered all around the state also. So it's to be able to connect people together, to network together, to be able to help people.
Right. And I know we've had, I mean, I apologize, I missed the last meeting, but the meetings I have gone to have not only been informative, but sometimes kind of scary too. I mean, when some of the facts and figures start coming out, you know, even those who have been following it and been working in it, you see some of these figures coming out, you know, the fact that there aren't enough recovery sources, people who are ready to go into recovery, and there's nothing available. There's a waiting list. Well, how do you tell an addict? How do you get an addict to wait 30 days or 60 days and say, all right, don't use for 60 days until a place opens up.
Yeah, that's flawed.
Yeah, I mean, otherwise
Absolutely.
they really wouldn't be addicts, would they?
No, probably not. And I mean, the key piece here too is, I mean, there are beds available and there is homes available, but also to the individual needs to like advocate for themselves. I mean, insurance is like if you have state insurance, they, you know, they will cover a certain amount of stay, and and the education piece that needs to happen with the insurance companies is, I mean, they think that somebody goes into detox, you know, and detoxes get the drug's not in their system anymore, that okay, they're all set and they're all well. And that's not the case. Recovery is like a life-changing psychic change that needs to happen. Like behaviors need to change, you know, people and places need to change. It's a whole life change that needs to occur for the person to sustain recovery. And, you know, it's sometimes hard to do when you take them out of their environment and you put them in another environment to clean them up, and then you put them back in that same environment without resources available. And also too, like I know private insurances, they don't, a lot of them don't cover behavioral health. So it's advocating, you know, at that level too. And when you get somebody who just wants to get better and doesn't want to feel sick, they're not want to sit on a phone for like, you know, sit on hold for an hour and a half waiting for somebody to tell them we can't help you. When they can help, you know, they need to help. They're responsible to help. And we do have the parity too that Moar advocates for, the insurance parity, you know, that for services, behavioral health services, detoxes and stuff, that, you know, they shouldn't be denied that treatment.
Right. And you know, well, before I get into the political aspect of it, you know, and what I think about politicians and why they seem to, I don't want to say ignore, but kind of avoid the addict and their recoveries. And so, I mean, they all talk about the war on drugs and the fight against it, but, you know, as far as the ones who were affected by the ones who were selling it and so forth, they just kind of push them aside. But I do know, because I remember when you drafted me, and we had a sit down with then State Senator Steve Paine. Why don't you tell them about the piece of legislation that you guys were working so hard on, as far as the, you know, another addict calling an addict on an overdose and so forth?
Could. That is the Good Samaritan bill that was actually passed this past Friday with the crime bill. Thank God. Thank God. What had happened is, to my understanding, a bunch of politicians went around to their communities to find out why, you know, what's the problem in the community. And what they came up with was, you know, the piece about people not calling 911 because they're afraid of picking up a criminal charge or something. You know, so people are dying from overdoses. So basically what this bill does, unless the person has a warrant or unless the person has a large quantity of substances, which would be distribution, they will not get arrested for calling on somebody that has an overdose. And also that it will also, like parents, if they know that their children are using, they can get a prescription for Narcan, which they'd be able to administer to their child to save their child's life.
Matt, why don't you explain exactly what that drug is? Because actually I just heard about that recently myself.
Narcan, it reduces, reverses an opiate overdose. Right. So it shocks the drug out of you. And you know, it only lasts for 30 to 60 minutes, so medical treatment is needed after that's administered. But also too, is if that individual was to use it again within, I think, 24 hours, it would still be in their system. And that you can get a prescription for that from the doctor. The parent could, or a friend could. To my understanding, EMTs do carry it, and I know a few police departments around the Commonwealth also carry it. Okay.
So if those individuals, public safety individuals, they come across what is an obvious drug overdose, they give them a pop of that, and that does reverse the overdose, so that obviously they'll send them to the hospital, but then they're treatable after that.
Exactly.
That's a good thing. That's a good thing.
Absolutely.
Now tell me something. When it comes to, and again, you know, I've been kind of advocating for this quite a while. The thing that bothers me, and I remember quite a while ago, I had a discussion with Sheriff Cousins, and he made a statement that something like 75 or 80% of the inmates are drug addicts, not drug dealers, you know, people who had to who had to do criminal acts in order to get there. Now, I know for a fact it costs more to house somebody inside of a prison. Why do you suppose we can't get these politicians to more recovery places so that there aren't those waiting lists? And financially, I mean, it's going to save money. I mean, is there anything more the organization like that can do to advocate for more treatment facilities?
We are actually advocating. There is a component in the prescription monitoring bill, which is S2125, that we're hoping to get passed also. And what that does, if that bill gets passed, it will, like, there's going to be a pilot program in five schools, in the middle schools in the Commonwealth. I mean, the Commonwealth is doing stuff. There is drug courts that are available. You know, it's a culture change that needs to occur. I mean, a lot of people look at it, okay, the person committed a crime, they need to pay for the crime, which very well, obviously, it's not okay to commit a crime.
Exactly.
But if they're committing a crime because they're a sick individual and they need to not be sick anymore, treat the core. But the criminal justice system isn't, their curriculum, for lack of better words, isn't about treating the core, it's about punishing the criminal. Right. So it's a culture change that needs to occur. You know, and that takes time. It takes time. I mean, I know that Lawrence has a drug court that's going on. I know a few other courthouses in the Commonwealth do have that, and some of that pans out to be successful for the individual that's involved with that. So, I mean, it's not, I mean, getting somebody to understand, it's hard to think outside the box. Yeah. I mean, I like to think that I think outside the box, but sometimes I'm pretty adamant about it being black or white, it either being one way or another way. And it's hard, unless somebody's been touched personally, it's hard to get them to not have that stigma about the addict, you know, that scumbag loser, right, that's, you know, breaking into people's houses, knocking.
You know, you'd be surprised how many times that exact expression has been used on this show by me and Colleen and so forth like
Beautiful.
That. Now, and again, I know the Moar organization, I know they do. Now, one of our biggest goals, you know, in the future, I hope to have school superintendent here and Dean Bruder, the drug counselor. You know, we're trying to get an awareness out. What about more? Is there anything that they can do or they are doing to get an awareness out to middle school kids, early high school kids, the parents of those kids, something to that effect like that?
Absolutely, we are. I know we are involved with the recovery high schools around the Commonwealth. There's a few. A few of those, the recovery high schools, and they do attend our events. When we did the Northeast Policy Forum, we did that in Danvers, and we did have somebody from Beverly and somebody from Newburyport that was from the school system. So we do try to reach out to the entire population.
You know, every time you say something, I have 10 more questions.
Okay, do we have enough time?
Probably not, but maybe you might want to give an explanation of exactly what is a recovery high school.
Okay, a recovery high school is a high school where it's drug and alcohol free. They have their normal curriculum that they need to do, but then there's also like counseling that's there, that there's introductions to different fellowships, you know, 12-step fellowships, you know, different other ways to recover. And it's a safe environment for the kids, because what they were finding, and parents actually started this piece, that in different communities, because what was happening is their children were going away, getting treatment, going back to their original high school where they formed this addiction and ended up using again. So that's how the recovery high schools came about.
So this recovery high school is for kids who do have a problem? Mm-hmm. What a great idea. Yeah. And how many are them around in the area?
There's 5. There's one in Boston, one in Beverly, one in Springfield, one in Brockton, and another one.
So, you know, which is amazing when you start thinking that there's 5 high schools in Massachusetts that cater just to those kids who have an addiction problem. I mean, that's a lot. Those are, and that's not counting the ones that are in school that nobody knows about or anything like that either, you know?
Right.
That is absolutely incredible. So what do we do to the kids? But they're in high school, okay? I'm going to try and be doing some work with, like I said, with the school superintendent. What can someone like us do with the superintendent, me, Colleen, so forth? How can we, I mean, is it more important that we get the knowledge to the kids, to the parents of the kids who still have some control over them, both?
All of them, everybody, all of the above, absolutely. I mean, the more knowledge anybody has, the better off they are. You know, and it's also the community recognizing, okay, this is an issue in our community and we need to do something about it.
Another problem. Yeah.
Only solutions.
Yeah. And what you said, you know, sometimes I get the impression that they don't make, I think they try to bury, I mean, MCAS scores are very important, the bullying situation very important. Those seem to get a lot of print, a lot of recognition. When it comes to kids, it seems like they don't want to discuss that a whole lot. Right. And that, I mean, we have a drug counselor for the high school, Dean Bruder, who does a great job. For one guy, he does great, and I know he has the support of Superintendent Judy Scanlon. But it just seems to me that they're not making as much of an issue out of it. Let me give you an example. Somebody graduates from high school, you know, then you read in the paper about 2 or 3 years later that so-and-so went on to Merrimack College and went on to law school, and they tell you what happened to them after. I wonder how they would feel if they said the same stories about the ones who had basically got their basic training in addiction in school, and although they may have gotten through school without becoming full-fledged, you know, full-blown addicts, 2 or 3 years after that, if they did a story about, you know, Jenny Jones, who was picked up for prostitution, had a thriving prostitution business after her graduation from high school, or, you know what I'm getting at like that? I don't, once they're out of the high school, they're gone, and the addiction that they developed in school kind of goes with them. And I think that's something that bothers me a lot, that they're not so concerned with the aftermath once they get out of school. And you know, you brought up something when you were first starting your intro, something that when we had Colleen and her sponsorship family brought up the same thing. You mentioned that you got your start in school.
I did.
And you were how old?
12.
12. What's that, 7th grade? 6th?
Well, my son's 12. He's going into 7th grade. Thank God he likes Yu-Gi-Oh cards.
Now, whereas you know, with your background and your son's 12, now, knowing what you do you have concerns about that?
I do have concerns. I mean, my son was propositioned 3 times last year, and I did go to his school. Somebody asking him twice if he wanted to smoke pot, once if he wanted to smoke cigarettes. And I did go to his school, and they, because my son came to me and said, I think you should run a group.
You know, I love it. I get all these signals like that. What have I got, 5 minutes left? 2 minutes, 3 minutes, 4 minutes, okay. Yeah, go ahead.
He came and
I told you we're very informal here.
That's perfect. He came and asked me to run a group because he knows what I do. I mean, I grew up in a home where, you know, you don't hang your dirty laundry out to dry. We don't have a problem here. You know, we dress up best, you know, dress up the outside, and, you know, there's all kinds of stuff going on the inside. But I have an open dialogue with my children. And my son asked me to, and I went and I spoke to the principal there, and they wanted nothing to do with it. So, yeah, that's...
Yeah, and again, and so you can see it from both sides. You can see that someone, you know, who works in this field, who was an addict, and now as a mother who has the same concerns, even more so because of your knowledge and background in it. Just so people know, because I know I can get your mini guide on the website.
Absolutely.
Can you give them the website of Moar?
Of course, it's www.moar, Moar, M-O-A-R, dash, recovery, RECOVERY.org.
Okay, and for any of you who are listening, you know, even if you got to Google, if you don't remember what you just said, just Google MOAR. And they have a mini guide on there that tells you all about Moar. It tells you all about the resources that are available, support groups like that actually is in there. Now, our group, Circle of Hope, is one of many family groups that are in there. And it's a world of information. They have phone numbers you can call, but you got to take the first step.
Absolutely.
If you're the addict, you got to take the first step, and if you're the family member of an addict, you even have to take a bigger first step, because it's hard to admit that your kid's a drug addict.
Absolutely.
And at that, we're going to be closing our show. Jennifer, I thank you for coming. I told you it was going to half hour to go by quick. I appreciate you coming, and please look in the website on Moar. To everybody out there, next month I hope to have Judy Scannell. I haven't corralled her yet, but I'm going to try. And Colleen should be back here with me. That being said, thank you for coming. Thank you for tuning into our show. I hope you'll continue to tune in. Call your friends, let them know about it. And at that, Jennifer, thank you again.
Thank you.
And we say good night to all of you. Thank you.